Coming up next on Arizona Horizon, it's the 50-year anniversary of Medicare and Medicaid, and we'll find out how driverless cars and other new technologies will impact cities and states. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of 8, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. A lawsuit against Arizona's expansion of Medicaid is set for a court hearing tomorrow. This after the case was delayed until the state Supreme Court ruled that lawmakers who filed the suit indeed had legal standing to sue. Lawmakers argue that the assessment used to fund the Medicaid expansion program was a tax and thus needed a 2/3 majority to pass the legislature. Supporters counter that the assessment was not a tax and only needed a legislative majority to pass. It's been 50 years this week that Medicare and Medicaid were enacted to provide health insurance to the elderly and those in need. David Sine is a regional administrator for Medicare and Medicaid. He's flown in from his office in San Francisco to tell us more about the two programs and their history. Good to see you again. Thanks for joining us.
Thank you.
All right, Medicare and Medicaid, what were they originally designed to do?
Really to first take care of people who were older. Back in 1965, a person that was over 65 was twice as likely to be in poverty as they were today, and more than half had no health insurance, and so a hospital stay or an illness could be financially devastating. And at the same time, states were struggling to take care of people who were medically indigent, who were poor, and this federal program of Medicaid was created really to provide support to the states.
So that was the problem it addressed. Has that problem been answered?
Well, I think the core problem has. So the rate of uninsured for people over 65 has gone from more than 50% to now less than 2%. So we have very few people facing that. And the life expectancy of a person turning 65 is 5 years longer today than it was when the program started. That's not entirely perhaps attributable to the program, but I think it's a very big part of it. And on the other side of the coin, in the case of folks with Medicaid, obviously we've got more folks in Medicaid than we have in Medicare today, and it's the primary source of health care for a lot of people who otherwise simply wouldn't be able to afford it.
I know that the racial barriers in health care were addressed by both Medicare and Medicaid. Talk to us about that.
Well, the significant thing was at the time the program was enacted, a number of segregated hospitals in the South refused to, they said they wouldn't take Medicare because they didn't want to comply with the Title VI requirements. But what we found is in that period of 1960 through 68, the hospitalization rate for black folks went up 61% compared to 38% for whites. So clearly a tremendous access was available that wasn't there before.
Opponents at the time, we can get to opponents now, but at the time, what were they concerned about?
There was a really large concern, and there was a campaign with Ronald Reagan as the spokesman about socialized medicine. So the medical community, the physicians were really concerned about the government having control over their work. And so the law was written to specifically say that nothing in the law should direct the practice of medicine. The purpose of the program was simply to insure people from financial harm that they would face if they were ill.
So some of those concerns, were they addressed? Did they materialize?
I wouldn't say that they materialized in the sense that the program directed physicians what to do, but Medicare and other insurers together, by virtue of the things that they cover, has an impact upon how the medicine is practiced. So in Medicare, we actually have physicians in each of the states make decisions about what will cover and what should be added.
So those were the critics back then. Critics now say Medicare, Medicaid, basically not financially sustainable. Is that a valid argument?
Well, in terms of Medicare, the trustees report that was just recently published said that the program, the trust fund, is solvent until the year 2030. That's pretty far in the future. Most of us aren't planning our financial life that far ahead, so I think that's a good thing. And the important sign is that while in the first half of the 2000s, we had Medicare growing at 5 and 6% per year. Last year it grew less than 1%. So we're seeing a slowing of this unsustainable growth, and if we can continue to improve quality and keep the growth in some kind of control, then we have a program that is sustainable.
Do we know why that drop happened?
Well, there's a number of things in the health law the change, the incentives that we use to pay so that we're looking at results rather than just incentivizing more services. And I think the whole medical establishment knows that people are looking for value, and so we're seeing more and more therapies that are better and more cost efficient than what we had in the past.
And yet, before we get to that, I was going to ask about future generations, but let's talk about this generation now, the baby boom generation. The impact of baby boom generation on Medicare especially. Talk to us about that, and again, does that pose problems for sustainability in the future?
Well, it's interesting. You know, there are countries that have a much older demographic than us. For example, the Japanese have a great deal more old folks than we do, and yet studies have shown that the healthcare costs of a country really are barely related to that issue. So the real challenge of growth going forward is that we continue to have new therapies, new procedures, new drugs that are very expensive when they're initially created, and we have to find a way to make those innovations available to people in a cost-effective manner. The fact that people are getting older, we can manage that. What we need to do is find a way to manage the cost of new and expanding services.
Will management also include things like benefit cuts, increased deductibles, maybe changing the age qualifying rates? I mean, are those possibilities?
Well, those are things that could be done, but I don't hear anybody talking about those things. I think the many people who have ideas about how we can improve Medicare, and we can always improve any program, I think are mostly focused on ways to make the program more efficient and ways to have the program help healthcare providers do a better job and use the services more efficiently, and most importantly, to teach caregivers, patients, and their families how to manage their health better and how to make better decisions about their health care.
And that kind of information is often included as well in the Affordable Care Act. Talk about the Affordable Care Act and its impact on Medicare and Medicaid.
Well, the really significant is Medicare has always been a great driver of innovation in healthcare. So Medicare created the prospective payment system for hospitals that the industry uses now. Medicare created the physician fee schedule that the rest of the industry uses. And now we have new models like the patient-centered medical home with a focus on primary care and prevention. We have first dollar coverage for preventive services and screening services under Medicare that we didn't have before. A lot of people taking advantage of those things. And we have these arrangements called accountable care organizations, of which there are several here in Arizona, where we make an arrangement with groups of doctors and physicians to work together toward quality targets and efficiency targets, and then there's a financial bonus for them. So the idea is to have a win for the taxpayers and a win for the beneficiaries and doctors.
I know a lot of folks that are critical of Medicare will talk about fraud, and they'll point out that fraud is a problem, has been a problem, will always be a problem. What's being done to address the problem?
Well, I think what we see in these various iterations of legislation is that the Congress understands that we've always been able to recover about $7 for every dollar that we invest in program safeguards to prevent fraud, and we greatly increased that investment in the Affordable Care Act. That strike force with the Justice Department and RIG has a 95% conviction rate. So I think the Congress in the future will continue to see that this is an area to invest, because if you and I could invest in guaranteed 7-to-1, we would invest in that. And I think you're going to see the taxpayers invest more and more and reduce this fraud problem by having the folks there that can root it out.
Last question. We're heading into the political season, and there are a lot of folks out there who will be using Medicare especially as something to espouse upon and talk about and run their campaigns with. I've already heard Jeb Bush say it's an unsound health care system, and that's probably the nicest thing I've heard from a number of candidates so far. When you hear that, how do you respond?
Well, you know, I'm not in that political space. I'm a career government guy, and what I would say is we have a plan. The program is on a sustainable track until 2030, but no program is the final answer, and it will change. And so by the time people that are young today are in Medicare, perhaps it'll be different, maybe it'll be better. And so, sure, there's an opportunity for change, but I think that we're on a pretty good course for right now, and I think most folks would agree with that.
And healthcare itself will likely change.
Exactly.
Practices will be a whole different ballgame back then. Right. All right, good to see you. Thanks for joining us.
Thank you.
Tonight's edition of Arizona Technology and Innovation looks at how driverless cars and other new technologies could impact state and local governments. Joining us now is ASU School of Public Affairs professor Kevin D'Souza. Good to have you here. Thanks for joining us.
Thank you. Thanks for having me.
Unintended consequences of technology. What are we talking about here?
So a lot of the emerging technologies that are occurring out in the marketplace, they are going to provide enormous positive benefits to local governments, to individuals, and also to organizations. And so those are the highlights that have been covered by the media and other places. What our research has examined is what happens when those technologies have unintended consequences. So as an example, when you have automated vehicles, obviously we are going to have fewer road accidents. Obviously, we are going to have fewer incidents of individuals driving under the influence of alcohol or drugs or things of that nature. Those are all good. However, local governments are also going to lose revenue because you're going to have fewer cars in the marketplace. You are going to have fewer insurances because the whole insurance industry that is based on you and I driving is going to have to change its model, where individuals are not going to be paying for services. So there are a lot of unintended consequences, and especially local governments are going to feel the greatest impact because we all operate in a local government context.
Even something like parking meters and parking meter notification systems and all these things, they're probably already starting to affect that.
Absolutely, and so we examined the data in Washington, D.C. So now you have an app that alerts you 12 minutes, 8 minutes prior to your meter expiring, and you can automatically update the meter.
Yeah.
Whereas previously, you would have to run out or risk getting a parking violation, and now the local governments lose out on those revenues. And the real tricky thing is the loss of these revenues does not just impact one aspect of a local government, because revenues like parking tickets impact how they work on parks and communities and things of that nature.
Indeed. Okay, so we talked about driverless cars and parking meters and these things. Drones, artificial intelligence. I mean, we're already hearing about these, especially drones, but AI as well. Talk about, again, the impact that municipalities might be feeling from these things.
So drones is a nice example to use. So very recently, you had an individual who, for about $800, was able to weaponize a drone, right? And so this is, you go and you get an off-the-shelf drone, very basic technology, and you have a weapon, right? So local governments have not yet grasped the reality on what to do with these things. Drones also, so about a year back, or maybe a couple years back, Amazon tried to bail out the US Postal Service by giving them an option to deliver their goods on the weekend. But now Amazon is actually experimenting with drones that will automatically deliver stuff. The whole trucking industry is going to be completely transformed with automated vehicles, so things of that nature.
So basically the idea is municipalities, states, local governments, they better get ready not only for the infrastructure, the law enforcement, the rules and regulations needed, but the loss of revenue.
Exactly.
And
yes.
okay, I noticed that immigration, there was supposed to be a significant impact on immigration as well, and even an impact on income inequality. Talk to us about that.
So income inequality is one of those things that we have seen the gap widen over the last few years on a number of different dimensions. What automated technologies have the propensity to do is make that even worse, because with previous revolutions that have happened with information technologies, you had individuals displaced through automation. However, they had a chance to enter another career. Whereas right now, the bar to enter another career is so high that the ability for you to retool yourself to enter that career is very low. So and a lot of the automation is going after jobs that unfortunately are sources of income for the lower end of the economic ladder.
And that would then impact radicalization of some of these young folks, correct?
Well, yeah, so radicalization is an independent issue. I mean, that's going to happen regardless of income inequality. But income inequality does have the potential to aggravate that further.
Yes.
And so radicalization, in my mind, has to do with the fact that the conflict environments of the world, and especially the conflicts that we are dealing with, today we have an enormous amount of media where individuals locally are getting radicalized, whether it's in New York or Philadelphia or even in Arizona. And so what these emerging technologies are doing is allowing you to connect globally much more easier than locally. So just as an example, if you were to ask the average resident of Phoenix, do you know the phone number of your neighbor? Chances are probably no. But do you know individuals across the globe? Yes. So the propensity to get radicalized, especially for those who are already on a very negative trajectory, will increase, and emerging technologies have a huge propensity for this.
Okay, so we set out the table there, and the table's a little concerning, and it's a little disquieting. How can you be more proactive in managing new technology? What can governments do?
So the number one thing that I have advised my colleagues who are local government managers is you need to begin thinking about radical innovation right now. Don't just think about how do you make small tweaks. So when you think about automated vehicles, drones, smart environments, the whole sharing economy, right? Don't just think these are not going to happen. They are happening, and they're happening at a pace that is fast. And so how do you get your agencies to appreciate this reality? How do you engage your community in a dialogue about what is acceptable and what is not? And how do you begin the process of transforming your agency right now? Because you are not going to have a time to react, and if you only wait to react, the technologies are going to dictate what you're going to do. So they have to experiment, they have to engage their communities in a dialogue, and they have to have a sustained perspective on radical innovation.
Very interesting stuff. Good to have you here. Thanks for joining us.
Thank you.
Get the inside scoop on what's happening at Arizona PBS. Become an 8 Insider. You'll receive weekly updates on the most anticipated upcoming programs and events. Get the 8 Insider delivered to your email inbox. Visit azpbs.org to sign up today.
The man behind an iconic Phoenix restaurant was recently the subject of a full-length feature film. Producer Christina Estes takes us behind the scenes to show us how and why the movie was made.
I thought, okay, I keep passing this restaurant, and I heard all these rumblings about it. So I thought, okay, I'll dig a little deeper, and then I found out about Jack.
More than 50 years after Jack Durant tried to make it in the movies, a movie is being made about him.
He's a legend. He was never quite good and never quite bad.
And his life story has never quite been clear, not even to Travis Mills. He wrote and directed the film Durant's Never Closes. It's based largely on Arizona author Mabel Leo's book, The Saga of Jack Durant.
He came here from Tennessee. He spent some time in Miami, Arizona, where he supposedly helped run a brothel, right? Worked in the mines and helped run a brothel. And then he also spent some time in Vegas, where supposedly he knew Bugsy Siegel, the famous mobster. Then he came to Arizona and opened Durant's in 1950.
According to Leo's book, Durant landed a small part in a Western, but his movie career never took off. Still, Durant's became the place for Hollywood stars visiting Phoenix. Celebrity sightings, dim lighting, and a questionable owner attracted the locals.
The right people started coming here, and they would tell a friend, and it became, you know, the elite of Phoenix.
For 15 years, B.J. Thompson served as Durant's maitre d'.
Very busy.
She knew who to seat, where, and when. They often served 300 lunches in a single day. Thompson's laps around the restaurant were always made wearing high heels.
Mr. Durant required his girls to wear dresses or skirts, no slacks.
Before people used the term politically incorrect, they probably could have used Jack Durant. He was known for using foul language, calling women broads, and hitting on female customers. but Thompson says he always treated his workers well.
He would come in and go to the bar and stay there a while, and maybe on his way out he'd come by and take my hand and say, here, buy you a cool one on the way home. And it could be anywhere from $20 to $100 bill. Didn't matter. He'd just reach in his pocket and whatever came out, that's what you got.
I heard a story about getting mad at a customer and him running into the kitchen to grab a meat cleaver and everyone at the restaurant having to stop him from killing the customer.
Those contradictions became a key focus during filming.
And action.
Tom Sizemore plays Jack Durant. It's the first time Mills has worked with Hollywood talent.
I felt like he had a great understanding. He said something to me like, there's everything in this character that you'd ever want. Sadness, happiness, danger, loneliness, everything is right here in this guy. And when he saw that, I thought, yeah, he can do it.
Durant's never closes, ever. Thanks a lot.
Michelle Stafford plays Susie, Durant's third, fourth, or maybe fifth wife. No one knows for sure.
Cut, excellent. Moving on to scene 73.
I love a film environment. I love a bunch of people, creative people, getting together, wanting to make something great to entertain others. I really dig that. So any group that wants to do that, I want to be a part of that group.
So it's more in the wrist.
A little faster.
Faster.
The film takes place in the 70s and includes a scene about the murder of Arizona Republic reporter Don Bolles. A source had promised Bolles information about land fraud involving organized crime but never showed for the meeting. As Bolles left, a bomb ripped his car apart. 11 days later, he died.
Supposedly, Bolles' murder was planned inside Durant's. That's what he claimed, and that's what people have said for years. We don't make any grand statements in the movie about Durant's involvement with the Bolles thing, but it's definitely a representation of, is Durant a good guy, or is he a bad guy, or is he walking some kind of moral gray line, which is what the film is really all about.
Am I dialed in?
Mills' team transformed a soundstage into a replica of the restaurant. Going Hollywood on a Phoenix budget requires patience and practicality. Mills has both.
Most people would make this movie for $3-5 million, and we're making it for $500,000.
That means spending less cash wherever he can. Buying these carpet tiles at thrift stores save Mills $700.
Now, $700 doesn't sound like a lot, but it will matter if we save $500-700 on every single purchase. So that's creative producing to me.
Slate.
Scene 112 Alpha, take one.
Action.
I don't think the boys are ready to let you leave yet.
My hope is that this movie really puts Phoenix and Arizona on the map in terms of making it a filmmaking town.
Everything good about me is in this place.
I don't think it's too local because it's a human story. And well told, people will just be interested in seeing it.
While Jack Durant struggled with his people skills, he aced his rapport with animals.
He loved his dogs. And I think they were probably #1 before any of us.
His final pet was Humble, the English bulldog.
The name Humble comes from his slogan. In my humble opinion, Durant's is the finest eating and drinking establishment in the world, which he won second place in a national competition for best slogans.
When Durant died in 1987, he left Humble his house and a $50,000 allowance. Humble plays a special role in the film's final moments, but Mills won't reveal details. The restaurant is now run by the family of Durant's former partner, Swede McElroy. But the namesake is never out of sight. Photos line the walls of the restaurant that Durant never wanted to close.
Filmmaker plans to submit Durant's Never Closes to a number of U.S. and international film festivals.
We want to hear from you. Submit your questions, comments, and concerns via email at arizonahorizon@asu.edu.
Thursday on Arizona Horizon, we'll look at how new technology is helping and hindering access to public records, and we'll hear about Tech Shop Chandler, which helps turn innovation into reality. That's on the next Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of 8, members of your Arizona PBS station. Thank you.
ASU's Ira A. Fulton Schools of Engineering strive to advance research, education, and industry to transform our economy. Ideas, talent, and technology for Arizona. You can learn more at engineering.asu.edu/TV.